Well, welcome everyone. My name is Stephanie Sargent, and thanks for joining us for today's webinar. Our presenter today is Dr. Kevin Moser, SE Healthcare Senior Medical Consultant. But before that, he was the CEO of WellSpan Health, a health system of 8 hospitals, 200 ambulatory sites, and over 1,000 physicians. Over his 30 years of experience with WellSpan, he served in many other capacities, including Executive Director of a medical group, President of WellSpan Gettysburg Hospital, where he led the hospital to be named as a top 100 performance improvement leader for 2 consecutive years, and also Executive Vice President and Chief Operating Officer. Dr. Moser will speak for about 25 minutes today, and at the end we'll take Q&A. Please, everyone, I encourage you to submit questions via the chat control panel at any time during the presentation, and we'll get through as many as we can. With this, I thank you again for joining us, and I pass it to you, Dr. Moser.
Well, thank you, Stephanie. Good afternoon, everyone, and thank you very much for joining this webinar. Our goal today is not to give you a prescriptive, detailed checklist for reopening or expanding your opening of your practice. Actually, this would be impossible for 2 reasons. One is that there is a wide variation from state to state and even between localities within states in terms of the guidelines, executive orders of state government, and limitations on business openings. And secondly, there's wide variation still across the country in terms of the availability of testing and various supplies such as personal protective equipment or PPE. In addition to that, each of your practices is unique in its facilities, its size, its specialty of care, staffing, and its patient base. So every practice is going to require a unique and comprehensive plan for this reopening and expansion of services as we relax the limitations from the pandemic. So what we want to do today is to give you a planning structure that you can use as a starting place to develop your individual practice plan, the one that suits you and your patients the best and is compliant with all state, local guidelines and restrictions. So as an overview, we're going to be looking at 5 different areas for which planning is going to be critical moving forward. And they are staff and provider safety, financial management, development, pre-triage protocols, reimagining your schedules and your roles, and solidifying your knowledge and your compliance surrounding telemedicine. You'll notice that there's not a separate category here that concerns specifically patients. The reason for that is because we are assuming that your patients are always first. And in each of these areas in planning, considering the needs and desires of your patients will be paramount as you plan those areas. Now, this is not going to be a short-term exercise. We should be prepared for an extended challenge here. As you can see, the cases in the United States are beginning to flatten, but are still on the rise. No one knows yet whether we'll see a second surge a little later this year or how things will transpire as we continue to relax some of the restrictions and people are together more. And so in this planning exercise has to be a continuous exercise, not a single plan, but something that you come back to on a regular basis as your practice moves forward. So the first area we want to consider is provider and staff safety. And for each of these areas, we're going to provide you with a bit of supporting information and some references. And don't worry about these. They will be emailed to you subsequent to the webinar so that you have them at hand and you can refer to them at any time. The AMA has some excellent resources on its website that I would commend to you. And secondly, it's going to be important for you to continue monitoring your usual sources of information about what's happening in healthcare. As an example, in Becker's Hospital Review, they had an article about Stanford Health resuming its elective care. Because this is uncharted territory, it's going to be important for all of us to continue tracking what other people are doing and what learnings they're having from their practice reopenings, so that we take advantage of the learnings in this very unusual and unique circumstance. So in terms of safety, The first order of business is to project your PPE, which stands for personal protective equipment, your needs, and what the availability is, because this will determine what caseloads will be manageable. Your needs in this area will be completely different depending upon what type of services you provide in your office and how procedure dependent you are, what type of patients you're seeing. But it's important to think through, what do we need and what we can obtain, and are there any limitations in terms of the volumes we can do based on PPE availability. And if you're a procedure-based specialty, it's going to be important to collaborate with your local hospital and your surgical centers to determine that they have adequate supplies, so that you're not building your budget around caseloads that you can't do simply because of limitations of that equipment. Next is developing a screening plan for your employees. As your employees come into work, they should be screened in some way, depending upon availability of testing. Your plan may be as simple as temperature monitoring, symptom monitoring, and talking to them about history, or it could be as complicated as a standard testing plan. But regardless of that, you need to document that plan, and then you're going to need to track the results and document them confidentially, so that if there's any question, the record is there that you screened that employee as they came in. You're going to have to plan social distancing guidelines and pay particular attention to the physical layout and flow of your office. One thing to consider, for example, is if you have workspaces that are routinely shared by your staff, you should evaluate whether or not you can dedicate one workspace to one member of the staff, so that you're avoiding contact wherever possible. Likewise, if you have a flexible office flow in which multiple people prepare rooms and bring patients to the room, or multiple staff support a single provider, you want to think through how you might be able to alter your office flow so that, once again, you're minimizing the number of people that each of your staff and providers come into contact with during the day. It also makes it a little bit easier for you to maintain the cleaning and sanitation of the workspace if only one person or a minimal number of people are using it. Now, if your facility allows, you may want to consider separate spaces in your waiting room and in your clinical area to separate people who are sick in some way and people who are well. Pediatricians, as you may know, have been doing this for years in their waiting room, and not all facilities are going to allow for this type of separation. But you should think through, again, what your patient base looks like and whether or not this would be a useful tool for you to use. Regardless, you want to look at your office flow and try to design it to minimize the amount of time any of your patients are in the waiting room, and move them into the back into a personal space as quickly as possible. You'll need to develop a sanitation and sterilization plan, working closely with your cleaning service, and deciding what you're going to do in between shifts and what you're going to, and how often you're going to completely sterilize and clean your office. And that also includes projecting your needs for hand sanitizer and being sure that you have adequate places for your staff to wash their hands on a regular basis. Many practices are now exploring and looking at developing teams that they can rotate, so that you minimize the number of people who are in the office at any one time, and take advantage of extended hours so that you can maintain your volumes, but not necessarily concentrate all of your patients and all of your staff into the building at one particular time. And rotating those shifts can be very useful as you struggle to maintain and get back to your traditional volumes. Also want to consider and protect your more vulnerable staff. While we say older workers and providers here, that also would include any of your team that is vulnerable due to immunocompromise, illness, or high-risk medical conditions. And so you should be thinking through that and identifying those individuals if possible, and thinking through whether or not there are roles they can serve in the office that might create a more limited exposure to the potential for catching COVID than would otherwise be done in their current role. And then last, but maybe most importantly, is that you want to create clarity for your team around your triage and patient screening protocols. Your team will feel safer if they know and understand how you are balancing your needs of your patients and the safety of your staff. So communicate that vigorously. Second area you want to explore is financial management. The vast majority, and it's probably safe to say all, of physician medical practices are going to be experiencing a negative financial impact due to COVID-19. It's very difficult to escape. At SE Healthcare, we recently completed a survey as part of our burnout program of a significant number of independent physicians in practice. And there was a very strong feedback to us that the doctors are very concerned about the viability and the financial performance of their practice going forward. And so having strategies around this is going to be very important to make sure the viability of your practice, and you need to explore whether financial assistance will be important. And we provide for you a great resource from the American College of Physicians in exploring that financial assistance. So to start off, you should step back and think of your practice now as a new business and do some of the same things you might do if you were starting the practice from scratch in terms of pro formas, predicting volumes, predicting your revenues, and managing your costs to those predicted revenues. Many practices that are in a more mature phase don't budget these days because over history, the volumes have been pretty predictable and the expenses have been very predictable, and the practices have generated a fairly consistent process. So if you don't have a budget, you're going to need one, and if you do, you will need a new one. As part of this, make sure that you do a cash flow analysis to be sure that you have enough cash flow to sustain the business. Medical practices typically do not have high levels of reserve, and so cash flow becomes critically important. You may have to use your line of credit if you have one, and if you don't have a line of credit, you may consider getting one in order to support your cash flow needs, depending upon volumes moving forward. In addition, you should think about whether or not it's a good idea for your practice to apply for one of the Small Business Administration Payroll Protection Program loans. These terms are widely available. There's still some money left in that allocation. And so you need to have a list of questions, be sure you understand the program, and decide whether or not that's appropriate for your practice at this time. I'd also encourage you to take some time to re-energize your collection efforts. This needs to be done sensitively because obviously, given the current economic climate and unemployment rate, many of our patients are going to be in a financial situation they did not anticipate. However, this is also not a time, given the diminishment of our revenues, to leave a lot of money on the table. So reviewing how you collect your payments from both insurers and from payments and from patients, and from being sure that your collection efforts are optimized is going to be critical to your cash flow. This is a time where you might want to consider having a professional review your books and give you some advice on where your vulnerabilities are. And hopefully this is someone that's already familiar with your practice, but if not, most financial professionals can perform this service adequately. And then last, but certainly not least, is you should consider contacting and consulting with your malpractice carrier to assure you have all the necessary coverage to protect you during the pandemic. Issues like potential lawsuits for delays of care due to the fact that you've either had to close or limit your practice are important to be sure you're covered against, and that dialogue will serve you well, and it will be important to pick up any coverage that you're lacking on the advice of that carrier. Next area is working on your triage protocols. There is quite a bit of help on this. The CDC has a process map to help you identify patients with suspected infection. The AAFP, which is the American Academy of Family Practice, has a good blog on adapting your workflows for COVID. And then the CDC has a variety of tools, one of which we will provide you the link to moving forward. So given the fact that your practice will be less efficient by definition, and you won't be able to see quite as many patients as you did in the past. Means that you have to be sure you know which patients are going to get the priority for face-to-face personal appointments. As people get more comfortable with being out and about, and as states get back to work, there'll be some increased demand for those appointments, and you want to be thoughtful about who you want to bring in, how often, and when. You also need to be very thoughtful about what kind of patients you're going to treat with telemedicine, and what kind of patients your doctors and advanced practice clinicians won't, because they don't feel comfortable. And do your best to communicate that to your patients. Use your website, use your email list, whatever you have available to you, so that patients have clarity on what types of conditions they might have that they can handle without coming to the office, and what they should likely schedule an appointment and come into the office to have care for. We're going to talk about telemedicine in detail next. You should also develop screening protocols for your patients, so that if they appear to be at high risk for coronavirus infection, depending upon your specialty, you can either isolate them somewhere, or you can direct them to another place of care for treatment or for testing. And also pay attention to patient companions. Patient companions should be limited if at all possible. You should be thinking through what age you will see a younger patient without their parent, and perhaps even asking their parent to just wait in the car, and then calling them after the appointment to fill them in on the appointment. But it is impossible to not have some companions along with patients. The elderly very often have a son or daughter who needs to be there so that you can get an accurate view of that patient. But you do want to apply the same protocols for screening to them as you do to the patient that you're going to be taking care of. Training of your staff and education in all of your triage protocols is essential. You don't want your patients having confusions, you don't want errors, and you want your staff able to not only tell them what the protocol is, but be able to explain to them the rationale behind the protocol, so that the patient understands that you have their best interests in mind. If you're a specialty that performs a significant number of outpatient procedures, make sure that you've considered which patients should have their procedures performed first, so that you work down the queue in the way that benefits your patients to the greatest value. And remember that your volumes could be limited by the availability of PPE depending upon where you do those procedures. And then as tests become more available, you want to provide continuing clarity to everybody as to what your guidelines are when a patient requests a test. If the testing is still in some scarcity in your area, you need to have a protocol for deciding who you will send for testing and who you will not. Next is reimagining schedules and roles. And you have to do this because if you ask what's going to change, probably just about everything will change as we adjust to this new normal. And there are CMS guidelines in reopening that I would strongly suggest that you review and read, which will give you many very good ideas in this area. So as you see a continued demand for telemedicine services, and you will, it's pretty well documented that patients are finding the access to services by telemedicine to be useful and of reasonable quality, and intend to continue doing that even as the pandemic eases. We have essentially, if you think about it, trained our patients to two things during the pandemic. One, we've trained them to accept and almost anticipate some level of triage. Call before you go to the emergency room. Call before you come to the office. We might be able to handle it without an office visit. It is highly unlikely that we will return to the days when every single thing that the patient requires in terms of care is provided through a face-to-face office visit. So we need to be prepared for that. And thinking through what that ratio will be and what kind of resources you will need to devote to your telemedicine business as opposed to the resources you'll need to devote to face-to-face visits is going to be important, so you can deploy those resources optimally. the split between your in-office visits and telemedicine visits will continue to evolve and be different than pre-pandemic. And so you want to be sure that you have thought through the optimal use of your provider skill set and your staff skill set. Not all providers are well suited to a telemedicine type of visit. And so having a discussion with them about their preferences is going to be important, and being sure that you've developed roles to support this new reality will be important. We talked a little bit about scheduling teams and extended hours, but if you choose to go that route of having several teams and then having one team in the office at a time seeing patients for a block of time and then replaced by another team, you need to also be sure that you anticipate the fact that there will be absences. It's unclear, it's going to be uncertain to know which of your staff might have an exposure to someone with the coronavirus and be required to be out of the office for 2 weeks. And so having a plan to back up and fill those holes is going to be essential moving forward. You want to project your practical surgical volumes to the extent possible, and then think about the way that your proceduralist is working in the outpatient surgical space. Many of our doctors will operate at more than one surgical center and maybe also a hospital. And by proactively identifying the capacity and the ability of each of those sites, you may want to consider shifting some hours so that the physician can be most efficient at performing these procedures. Remember in all of this that there is an extraordinarily high risk among our doctors of burnout as a result of the pandemic. Some have already been working at an almost unsustainable pace. Others have been somewhat idled by the bans on elective and outpatient surgeries. But those physicians are about to be hit with the queue and high demand to have those services performed. So optimizing their efficiency and making sure that they have available ways to work down that queue is going to be important if we're going to prevent another phase of extended burnout among our providers. Finally, we want to talk a little bit about solidifying your knowledge and compliance around telemedicine. Again, this is not going away. For those of you who have had any business background, there is a writer by the name of Clay Christensen who has written some great books on disruption. And is unfortunately no longer with us, but his work is classic. And he talks a lot about the way something like telemedicine first has early adopters as the technology catches up, and then there's often some event or some technological development that pushes it over the edge, and then it becomes a standard and is utilized by a whole number of new adopters. Of course, the classic of that is digital photography versus film photography, and the rapidity with which once those early adopters developed the technology that made it more usable to the masses, it was like you flipped the switch and film went away and digital photography was here. And many people think that telemedicine, telehealth, care by video, et cetera, is going to continue to grow. If you see the numbers, and we'll give you the article here, the CVS, as an example, has experienced pretty much of an explosion of use of their telemedicine visits. And it's really considered to be part of the new normal. There's enormous investment going into it. So I would argue that if you are not considering a robust telemedicine opportunity for your patients, that they are likely to seek that elsewhere, and something that requires thoughtful planning on the part of your practice. But I think the first step is to be in discussion with the vendor from whom you get your electronic health record, and explore how they support telemedicine function for your physician. And then if you haven't, make sure you've optimized that functionality in your electronic health record. If they do not support telemedicine, then you should explore other options with vendors in order to supply the technological functionality that you would need to do that. For example, I just learned today that Verizon has a service in which they will work with physicians to bring the technology to bear that they can provide secure and safe telemedicine visits. Because as you do this, being HIPAA compliant and assuring absolute privacy and security is going to be critical. Using Zoom to do your telemedicine visits is not a sustainable strategy. The last thing you want is to be doing a sensitive medical visit and get Zoom bombs, so to speak, another new term in our lexicon. You need to have very strict documentation protocols to be sure that you're documenting the visits accurately and thoroughly. The billing rules are in flux, as you're probably aware. Both CMS and private insurers have loosened and begun paying for telemedicine visits. We don't know how much of this will continue as the pandemic lightens, but it seems likely that it will continue and the rules will continue to evolve. And so staying up to date on that billing and having a plan for introducing that billing into your system is going to be very important. You also want to be sure that you're doing the things that limit your medical liability. You can seek consultation with your carrier on this, and there are many resources on the web to help you with this. But the bottom line from my standpoint is this is one area as you plan that you may want to consider working with an expert to review your procedures and your policies and be sure that you're compliant and that you're optimally billing. And with that, I'm going to turn it back to Stephanie.
Thank you, Dr. Moser. So we have a couple of questions that we'll run through. I do encourage everyone, go ahead and submit your questions now for Dr. Moser and we'll get through them. I did want to mention that SC Healthcare specializes in resources that help you, your practice, and your providers navigate and manage these very challenging times. So included in that is a burnout prevention platform, as well as COVID-19 preparedness and risk mitigation tools and an assessment. So for more information on these resources, please reach out to us directly or on our website, and I invite you all to check them out. Okay, a couple of questions. Someone asks, will the slides be available after the presentation? Absolutely. We'll be sending an email to all of our attendees. Included will be a link to the PowerPoint and other resources on our website. So thank you for asking that. Second question, what are my options if the doctor either can't or won't do telemedicine? Dr. Moser.
Well, that is a tough question. I think that what I would suggest you do is take advantage of some of the resources we have. And if we can help in any way, please let us know. But I would begin a pretty strong program of education. Telemedicine, if you think back, and I would suspect that the same phenomenon happened during the explosion of urgent care. When urgent care centers began rising up around the community, a lot of our reaction as physicians, and we're not typically known as people who love change, was that nobody will go to them because they want to go to their own doctor. That was proven to be untrue. And then our next strategy was, in some cases I know of, to kind of admonish our patients that it's not good care and they shouldn't go. And yet every corner almost has urgent care now. So I would attempt to gently provide as much education to that physician and understand that to a certain extent, some of the resistance is built around a passion for continuity of care and a passion for their patients and a firm belief that it's better care to see the patient personally. And I actually agree with that sentiment. But we also have to understand that our patients have consumer behaviors, and every other aspect of their life has been made easier, more convenient, and more efficient through technology, and healthcare is going to be no different. So educate, gently educate, supportively educate, and look for ways to frame this development and what you can do in it in ways that connect with the doctor's passion for their patients.
Okay, another great question. Telemedicine is great, but some insurance companies have a payment deadline in a few weeks. Any word about them extending this so doctors are paid fairly for these visits?
Yes, I have not seen any update. I believe that most of the payers will continue to look to CMS for their guidance on this particular issue. Um, as is usual, it's kind of out of our control. And so if they do allow that to expire, I would be very proactive in communicating that to my patients so that they may be able to put a little bit of pressure on the payer to move forward. But I believe as long as CMS decides that it's in the national interest to continue paying for these visits, that there'll be a lot of pressure on the private payers to continue it. And it would be my bet that it would continue, but I don't want to bet with your money. So it's probably going to be up almost until the last minute until they release those final guidelines.
Okay, great. Next question, who do I contact to find out about state and local guidelines?
That will depend largely on the structure of your state. And, two states I'm very familiar with, one is Pennsylvania and one is Virginia. In Pennsylvania, there is virtually no universal local public health infrastructure to utilize. And therefore, in Pennsylvania, unless you're lucky enough to be, say, in Philadelphia County or in a city that's large enough to have a health department, you pretty much have to deal with the state health department for that information by going on their website or by calling going forward. If you are fortunate enough, as for example in Virginia, where they have regional health departments, and I would go with your regional health department, and they'll be able to translate for you not only where the state's directives are, but but also what local nuance there may be to those guidelines. If all of that fails, then I believe that that's a place where you should use your local hospital infrastructure as a resource and be in touch with your local hospital, and because they will have many more resources that are connected in with the state. The last area that would be an option for you would be your state medical society. The state medical societies, by and large, in my experience, have been keeping up with this pretty well, and they're a good place, a good source of answers and guidelines for you. And obviously, you're paying dues there, so you should be supported by them optimally.
Okay, great. So I think that's it for the questions. Thank you, Dr. Moser. We certainly hope that everyone enjoyed the presentation and got a lot out of it. As a reminder, we will send all the attendees an email follow-up, and we encourage you to use the resources provided and to peruse our website for other tools and resources that will help you in your practice. Please feel free to reach out directly to us. On the slide is all of our contact information as well as on the website. Thank you again for attending. Take care, and we'll see you soon.